Hey, thank you for joining us for today's Meet the Advocates, a webinar series hosted by the Western Center on Law and Poverty. My name is Nora Olagbaju, and I am the Development and Events Manager here at the Western Center. I'm so glad to have you all with us for this important conversation. Today, we are going to delve into the governor and legislature's three-house budget agreement that maintains cuts targeted at millions of Californians who have health insurance through Medi-Cal, including immigrant families and older adults. Our discussion today will include a high-level budget overview, a revenue discussion, an analysis of the approved budget cuts, and a look at what's to come in both the state and federal landscape. I'm going to briefly introduce our incredible speakers, Christine and Linda. Christine Smith is a policy and legislative advocate for Health Access California. Christine previously worked as a policy analyst at the California Partnership to End Domestic Violence, advocating for the needs of domestic violence programs and survivors. Christine received her master's in public administration from the University of San Francisco with a concentration in healthcare and her BA in political science from UC Berkeley. Prior to her work in the domestic violence field, Christine worked in the healthcare space as an associate health policy analyst at the California Rural Indian Health Board, as a program assistant at Sierra Health Foundation, and as a community affairs coordinator at the California Consortium for Urban Indian Health. Now for Linda. Linda Nguy is the Associate Director of Policy Advocacy for Western Center, specializing in healthcare issues that affect Californians with low incomes and providing mentorship to our Sacramento advocacy team. Prior to joining Western Center, Linda worked with the states of Washington and Mississippi to help establish their state-based health exchange. Specifically, she drafted the online application for subsidized and unsubsidized qualified health plans. She also worked on California's behavioral health education system as a policy associate for the Latino Coalition for a Healthy California. Linda received her MPP and MBA from the University of Minnesota Twin Cities and her undergraduate degree from Brown University. We'll hear from both speakers now and open it up for a Q&A at the end. And as I mentioned before, feel free to drop any questions in the Q&A tab throughout the presentation. Now I'm going to hand it over to our fantastic speakers, Linda and Christine. Take it away.
Thanks, Nora, for that wonderful introduction. Again, I'm Linda Nguy, Associate Director of Policy Advocacy at Western Center on Law and Poverty, and thought I'd just start with a quick overview of the budget process and share some of the highlights, or what health advocates would call our lowlights of the budget. So as many of you may know, California's fiscal year began on July 1st with the final three-house agreement. That's the agreement between the Assembly and Senate leadership, and the governor was signed just a few days prior to that. However, the actual budget process goes back many months, with the first public document being the governor's initial budget in January, followed by budget hearings in both the Assembly and Senate, and the governor's updated budget following tax returns known as the May revision, and then finally final negotiations between the three parties. And so there were some differences between the governor's May revision and the legislature's two-house agreement, but for the most part, many of those discriminatory health cuts that were proposed in the May revision remained in the final budget. Over $4 billion, or 1/3 of ongoing budget cuts, is achieved through immigrant families losing Medi-Cal coverage through enrollment lockouts for undocumented Californians, as well as unaffordable monthly premiums, and elimination of adult dental for Californians without satisfactory immigration status. That includes undocumented Californians, as well as lawfully present immigrants, such as those newly qualified immigrants who have not yet met the 5-year bar, and individuals who are permanently residing under color of law, commonly referred to as PUCAL. While we appreciate the budget rejected some of the most egregious cuts targeted at older adults and people with disabilities, we are deeply disappointed that the budget did not adopt any new revenue solutions beyond approving the mandatory single sales factor apportionment already in the governor's January proposal. Coupled with the passage of the federal bill, which could result in up to 3.4 million Californians losing Medi-Cal coverage and the loss of hundreds of billions of dollars in federal funding to Medi-Cal, now is not the time to be balancing the budget on the backs of low-income immigrant families. So we continue to urge state leaders to advance revenue solutions. Christine will go into a little bit more details about the Medi-Cal enrollment lockouts that will take into effect in just a few months.
Thanks, Linda. And thanks all. My name is Christine Smith, she, her pronouns, and I'm a policy and legislative advocate with Health Access California. So very pleased to be with you all. I attended a lot of these webinars in my previous position, so I was really honored to be asked to join. I will also echo that these are more lowlights than highlights, but they are information just the same. So just to really talk about what the next step in this process, which is, or kind of the next major piece in the timeline, which is those lockouts or a freeze on enrollment. So that will impact all, that will impact the UIS population. I have a handy dandy spreadsheet that we have been using because there are so many different pieces in this. So if I look to the right, that's just to make sure that I'm telling you everything that's accurate. But does apply to undocumented adults age 19 to 64. But that means that if anybody disenrolls for any reason, including failure to pay the premiums that Linda will talk about later, they will not be able to re-enroll in the program. So I think we all are very aware, but you have to make hardly any money to qualify for Medi-Cal. This really disincentivizes you from making more money because if you go back to that lower income, you would not be able to re-enroll in those programs. So it effectively closes the door on enrollment for undocumented people. So that is hugely problematic, but really problematic in any number of ways, closing the door to this essential program. And that does start in January of 2026, which is very, very soon. We are already more than halfway through 2025. So again, the losing the ability to enroll in total is problematic, but losing the ability to enroll, even if you've been a previous enrollee, is especially concerning. So we are definite low light in the budget process.
Thanks, Christine. I'll talk a little bit about some more of the lowlights, particularly on Medi-Cal premiums. So the budget also introduces monthly premiums of $30 for adults, excluding pregnant people without satisfactory immigration status, effective 2027. While this is better than the May revision that had monthly premiums of $100, $30 is still unaffordable for many low-income Californians who, to qualify for Medi-Cal, as Christine alluded to, have to make very low incomes, less than $1,800 a month for an individual. So in addition to lowering premiums, the legislature also improved on the governor's proposal by limiting the age range from all adults ages 19 and older to those between the ages of 19 and 59, so that older adults, those 60 and older, would not be subject to these premiums. However, for people already struggling, this monthly $30 premiums or $60 for a couple can mean difficult decisions between rent, groceries, or even foregoing health coverage completely. Coupled with the enrollment lockouts that Christine just discussed, this means that for some Californians who are undocumented, if they miss just one premium payment, they can be permanently excluded from full scope Medi-Cal coverage. With many of the county indigent programs winding down or being dismantled completely, this means uninsured low-income Californians would have even less options for primary or specialty care than they did before. I'll also note that the federal HR 1 includes new restrictions on eligibility for lawfully residing non-citizens who have been covered through Medicaid, known as Medi-Cal in California, for decades. This means the state will lose federal matching funds for more people, but also that more people would fall under that category I mentioned, PRUCAL, permanently residing under color of the law, and be subject to a Medi-Cal premium. So that means an expanded immigrant population that includes refugees, asylees, domestic violence, and human trafficking survivors. Um, and so that is another cut to be expected. And for this newly expanded group of immigrants, um, and Christine will talk a little bit more about some other unfortunate cuts.
Yeah, absolutely. I did want to just mention that there's an elimination of adult dental for undocumented people that will start in July of 2027. This is actually considered a little bit of a win. Originally, the governor's May revise proposed removing adult dental, but also removing access to long-term services, long-term care services, and then also in-home supportive services. Last year, the governor had proposed removing in-home services, and our point to that had been people are just going to end up in long-term care. This time they proposed removing both. So in-home supportive services are really essential for people to remain at home. This includes a whole number of different people, including with people with disabilities that are really trying to stay at home for various reasons, and their family members are trying to take care of them. So um, this is huge. This was hugely problematic. It was not included in the final budget, but the fact that it was even included, that we were considering balancing our budget on the backs of these people and then continuing down that line and saying you're also not eligible for long-term supportive services. Um, what is your option is really kind of what that looks like. Is you're not going to be able to help your family members stay at home. They will not be eligible for nursing care. So it really raises the question of what would they be doing? Fortunately, the governor or the legislature rejected the proposed cuts to in-home supportive services and long-term care. Um, but I'm deeply troubled that we were even considering it. um, and then also they did end up eliminating adult dental for undocumented people. That starts in July of 2027, and that's for people over 19 and over with unsatisfactory immigration status. So that is across the board, unfortunately. So they did delay it a little bit from the governor's original proposal, but it kicks the can down the road. It doesn't make things better to have cuts later. It just makes the fact that someone is going to get a toothache on July 2nd of 2027 and not be able to get the care that they need in a reasonable way. And with all these cuts, people are not going to continue, people are not going to stop needing services. And I think we all know that. People will go uninsured, they'll go to the ERs, they'll die younger, their family members will not be able to stay at home with them, or they won't have other options. As a result of things like this and as a result of these problematic policies. But I do want to emphasize that thankfully, the IHSS cuts and long-term care cuts were rejected. But even with the concept is so problematic that we're fighting these fights. So we will keep fighting, but it does create a two-tiered system. So undocumented people will not have access to the same scope of care that other Medi-Cal enrollees will have. And it really continues to target undocumented people and immigrant communities at a time when they need our support the most. So do want to emphasize all of those things. This whole process makes me very frustrated.
Uh, Agree. There's a lot of lowlights as mentioned, but to bring in a more positive note, some of the more egregious cuts targeted at older adults and people with disabilities were avoided. So dating back to 2019, Western Center, along with our aging and disability right partners, co-sponsored legislation to eliminate the Medi-Cal asset test, and were able to successfully get it included in the 2022 budget. And prior to 2022, older adults and people with disabilities who had assets above 2,000 were not eligible for Medi-Cal. No other population was subject to this asset test, so this unfairly targeted older adults and people with disabilities, leaving them with inadequate resources to weather a crisis, whether that be potential eviction, a leaking roof, or a major vehicle repair. And so asset tests forces seniors and people with disabilities to spend down and impoverish themselves in order to get Medi-Cal. In 2022, the asset test was raised to 130,000 and then completely eliminated in 2024, removing a huge administrative burden in proving that you didn't have all these assets. The governor's May revision proposed to reinstate the Medi-Cal asset test to $2,000, but the final budget ended up with a reinstatement of the asset test at 130,000 for individuals or 95,000 for a couple. So while the reinstatement is a step backward, advocates knew that we would not be able to keep elimination completely. So are pleased that we were able to successfully advocate to go to 130,000 instead of 2,000. This is expected to be implemented in just a few months, January 1st. And so a very quick timeline, as you saw from how long it took to implement it. Over 2 years, when the department wants to undo something, they can do that pretty quickly. And we are working with the department along with other partners to minimize some of the impacts from the reinstatement of the asset test. Um, but I'll turn it back to Christine to talk a little bit about what's to come in next year's budget as well as on the federal side.
Yeah, absolutely. So while this has all been going on, while this budget process has been going on, there has been a lot happening on the federal side, including HR 1, which I refuse to call it anything else because that is its name. But there has been a very large bill that could drastically impact and does impact these programs. I think Linda mentioned the 13 million Californians that could lose healthcare as a result of this bill. We've also been doing a tremendous amount of advocacy at the federal level while we're doing the state level work. So it has been it's been a long year, even though it's only August. So do really want to emphasize California Budget and Policy Center's excellent resource on how much the federal budget impacts us and how much federal funding impacts the state. I believe it's 1/3 of all of California's budget. But really looking at that impact, there will be other impacts to Medi-Cal enrollees that are not undocumented or across the board with the work requirements that will be coming in the next couple of years and other pieces, including really having to re recertify, reattest, restate that you're still eligible for Medi-Cal. These are paperwork barriers. So what's next for advocates and what's next for our field is trying to figure out how we are working with people to make that as seamless as possible. The way that you save money through some of these programs is by making the system so complicated that people lose eligibility for Medi-Cal or other programs. So on the advocate side, we can make things easier if we can. What's next is we're not done. The next year's budget process starts basically as soon as this last budget process ended. So the Department of Finance and other folks are hard at work figuring out what the next year's budget process will look like. And we will be starting to do that advocacy. That said, I think everyone's trying to figure out the big impacts of HR1. There will be significant impacts at the state level that may have to be addressed because of different things that are included. Some funding that was coming through the MCO tax, the managed care organization tax, and other pieces came into the general fund, or and those may not be the case anymore. So we may have budget holes that we need to fill. We may have other things that we need to address even before the end of this legislative session. So what's next is more budget work. What's next is more advocacy. There's also still time before July of 2027. There's an entire budget cycle before then. Maybe there are ways that we can stop these impacts from impacting so many people. But there's always more advocacy to do in order to support the people that we need to support. So do you really want to emphasize the tremendous amount of things that are in HR1, specifically just across the board? But I think the thing that is concerning me right now is any impacts to the state budget that could cause us to have to make more budgetary decisions. So there is a hearing, I think by the Senate's or Assembly Subcommittee 7 on the 20th, where they will start to do some of that work on the Assembly side. So it also impacts way more issues than healthcare. So it will be, they're looking at it across the board. So, I think the official budget process will start in January when the governor will do his proposal. And then we'll kind of go back into the May revise and legislative cycles again. But really with the federal government the way it is, and with HR1 and with the state a little bit in flux, kind of having to respond so much to the federal side, we are in a space where we may have to, it may look different than it usually does, which is the budget is its own unique, special little animal. So stay tuned. I'm sure we will all be sending out resources.
Thank you so much, Linda and Christine. Linda, I don't know if you have any final thoughts before we head into the Q&A.
Thanks, Nora. I'll just add, unfortunately, as Christine mentioned, there's no way to sugarcoat the cuts that unfortunately have already been implemented or are coming down the pipeline on both the state and federal side. It will be hard as some of these changes are expected to take into effect almost immediately. But that doesn't have to be the case. Advocates have been raising revenues as a potential solution. Large corporations aren't paying their fair share. And instead of pursuing real revenue solutions, a leadership has chosen to implement discriminatory healthcare cuts targeted at immigrant families already under threat from a hostile federal government. With additional federal cuts on the horizon, California can and should do more to minimize harm. So we'll be working together in community to push and hold lawmakers accountable at looking at other solutions beyond cuts.
Thank you so much, Linda. So now at this point, we are going to go into a Q&A. If anyone has any questions, feel free to submit them in the Q&A section. And for now, I guess I can just get the ball rolling with the first question. So we spoke a lot about these budget cuts and the implications for the many million Californians at risk. Can you help us understand how California's revenue projection influenced the governor's decision to propose these cuts, and what alternative paths were available?
Go ahead, Christine.
I mean, the revenue projections were not good. There was a budget deficit projected. I have it in my notes, but a significant budget deficit. So we knew we were not surprised, or at least I was not surprised that there were going to be cuts somewhere. Um, that said, budgets are a statement of values. When you are budgets are a statement of values, and your choice to not seek revenue solutions is also a statement of values. So yes, revenue projections influence the ability to seek cuts, but where you're seeking cuts and your decision to absolutely not target large corporations or other folks um, that are not the same populations that we're talking about, that is a choice. There are alternative paths available, and one of them is revenue, and one of them is looking at different ways, but it did not have to be this way. Um, that's my statement.
And just to echo that, as Christine mentioned, budgets are a reflection of values, but also it's not just a deficit issue. It's a revenue issue, and so to only look at cuts when we like to pride ourselves. California is different. Well, we know that other states have also faced budget cuts and looked at revenue solutions. And so we can be different, but we can also lead and look at solutions beyond cuts that harm really the lowest income Californians and those, as I mentioned, who are already under threat.
Absolutely. Thank you both for your answers. We have a question that came through saying, where can I find the list of current cuts and a synopsis of the cuts?
Great question. I think we both have some I'll add to the chat some resources that Western Center has created, and I know Health Access has some as well. There's also other webinars and trainings that are being put on by ourselves and partner organizations. I believe um, Western Center, along with the National Health Law Program, will be doing one specifically on HR 1 on August 21st. So I will try to include some links into the Zoom chat.
I don't know how to Zoom chat everyone. I'm only getting hosts and panelists as a chat option, but I will put it in here and hopefully we can send it out after, something like that. Health Access did create a new state of healthcare coverage document that is super, super new on the impacts that are coming from HR 1, but also the state budget. So both are included in a timeline format. And since I know she had been on here, just a shout out to Rachel Gish, she worked really hard on that one.
Absolutely. Thank you, Christine. I just put the link you sent in the chat to everyone. And just for everyone watching or those that had to jump off early, we will be sending out a recap, including this entire recorded webinar and some helpful resources that we mentioned today. So everything that we mentioned today, I'll make sure to include that in the follow-up email, which will be sent to the emails that you use to register for this webinar. So if you're not keeping track of all the links in the chat, don't worry, it will be sent to your email following this webinar. I have another question coming in that says, for now, so I'm not sure if this is a question or a statement, but it says for now, IHSS payments are not in jeopardy.
Yep, that is
Okay,
correct because of all
got
the
it.
hard work that everybody did this year.
Got it. Thank you for confirming that, Christine. We do have another one that is, what is the impact on behavioral and mental health?
And now I'll start. So there's certainly, I think, a significant impact when you think of all the services that Medi-Cal covers, providing behavioral health services, substance use disorders services, and various, it's not just physical health services. And so the budget cuts to certain populations, but also the federal cuts will have an impact on how the Medi-Cal program is funded generally. And so as bad as these cuts are, Um, I hate to say this, it could get worse with the cuts down the pipeline.
Yeah, I agree. And just to echo, with the premiums, people will lose healthcare. With the unaffordable premiums, people will lose access to this. And with the freeze, people are going to lose access to Medi-Cal. So I think also the stress and trying to figure out all these different programs and what people are eligible for and how is also a behavioral health impact, to the people that we're serving, but also the many people that come into our field because they have family members or friends that are being impacted or could be impacted.
Thank you, Christine. I also see Adriana Ramos in the questions, just also said that the Cal Budget Center also produced a report on the state and federal budgets on their website, which I will add in the chat. So thank you all for these helpful resources. And that's going to lead me into another question that I had, which are, what can advocates and the community members do right now to fight back against these harmful cuts?
Go for it, Christine. Sorry.
No, you're fine. Get involved. We will have plenty of opportunities. We've had rallies, we've had different events. Melinda was a wonderful speaker at least one of them. Talk to your representative. We can put the find your rep in the chat. Though if you found this webinar, you probably already know who your legislators are, but always worth reminding you. So talk to them and say this is problematic and we need you to stand up for immigrant communities or older adults or everybody across the line. But certainly both our organizations will be doing a number of different activities. So you're always welcome to join any public events that we have. But my number one recommendation is always to call your representative and tell them that you're upset and that this is problematic and they're supposed to be representing you.
And I'll just add to that point, a lot of the focus has been on the federal side. I would say it's not the representative, not just on the federal side, but on the state side, to really encourage them to look at revenue solutions. It's not just a um, um, deficit issue, as I mentioned earlier. And so holding members accountable. If they have already taken a vote, right? I know the midterms are a ways off, and so but letting them know that you're unhappy with that, but even right now can let members know that they need to be looking at revenue solution. That this Medi-Cal, Public's poll has shown is a very popular program. That it's important, and so it is worth saving and worth minimizing these cuts that are coming down the line. And the way to do that, to be honest, is it has to be through revenue solutions. And so holding their feet to holding them to account that their vote to make cuts um, is being watched and they need to be considering other solutions.
Absolutely. Thank you so much, Linda. Um, I not seeing any more come through the Q&A tab, so I will just ask one more, give anyone an opportunity to add any final questions. But another question I had, and I know we touched on, there's federal and state context for this as well, but what role does the federal government play in shaping California's budget decisions for Medi-Cal? And are there opportunities for advocacy at the federal level?
There are always opportunities for advocacy at the federal level. So the same thing that I just said about call your representative works just fine for both. I think there are plenty of decisions, HR one included, that make their way down to the state in drastic and important ways. So if you see something or hear about something or want to tell them what's going on in your community, give them a call. You'll probably talk to an intern who's answering the phone, but every call gets recorded and every call, people, especially the more people are hearing about an issue, the more it's impactful. So just to give you an example, when the Violence Against Women Act was threatened to be cut in, I think, 2017, the congressman's office, who was in Chico area, their staff got so many calls that they came up to my friend, who was the executive director of one of the programs, and was like, please stop calling us. Like, please, this is impacting my work day. And you're like, yes, we are getting through. And that's important to share your opinion. There's certainly also town halls and different other opportunities for federal advocacy, but you want them to hear you and like remember that you are who they are representing. Even though it's 3,000 miles away, you are a phone call can reach pretty quickly. So, and all those decisions are really impactful, especially 'tis the season for appropriations. We're waiting to see if the federal government will be shutting down, things like that, that will all be incredibly impactful here.
Linda, did you have anything to add for that one, or?
I think Christine answered it pretty well as to my previous comments. Yeah, we can certainly hold them accountable, even though midterm elections is far away or not so far away, but letting it be known that we're dissatisfied um, at, with the votes that have already happened in Congress. And I know the Fight for Our Healthcare coalition is still underway. And so for those who are interested, um, uh, that coalition is still active.
Yeah, we will be doing a lot of work on implementation, so making things as streamlined as possible for the things that did get included. And then also, I believe, doing some accountability work and reminding people exactly what they voted for.
Thank you both so much. I just want to take this opportunity now to thank both of our speakers, Linda and Christine, for breaking down such a complex and urgent issue, and for all the work that you do in the fight for equity and access in California's healthcare systems. We know that these cuts are not just policy decisions, they're choices that affect the daily lives and health outcomes for millions. And today's conversation just, continues to make it clear how much is at stake and how important it is to stay engaged and get involved. As I mentioned before, if you joined late or want to share today's conversation, we'll be sending out a recording of the webinar, which will also be posted on our website. And we'll share all of these resources that we discussed in the Q&A as well, so you can continue to stay informed. And you know what? I think we do have one last question for you both. So I'm going to go ahead and put that last one in. It says, is there any word on whether there will be caps on the value of an owner-occupied home to receive Medi-Cal in California?
I'm not sure if I understand the question. So if this relates to the asset test, I will say that the primary home currently is excluded and so is not considered as part of assets. So I don't know if I answered the question, but feel free to ask it again, or I'll include my email in the chat if you want to reach out to me directly.
And I believe there are home equity limits in HR1, but they don't take effect until 2028. So that is something that we can provide more information on as well.
Got it. Thank you. I think they might have clarified and said limits on the extent to which personal resident asset is exempt. But again, like you said, I'm going to include the emails for both Linda and Christine in our follow-up. So if there are any more specific, questions, be happy to continue this conversation. And again, I want to thank you all so much for joining today, and thank you especially to Linda and Christine.
Thank you so much. I really enjoyed participating, and definitely feel free to reach out with questions. And thank you for your time. Enjoy your lunch break.
Thanks all.
Thank you all.